Really excited to be here today to kick off our April Symposium with you. And I know Stan did a brief introduction, but why don't I hand it over to you to share a bit more about your background and your focus area and why you're here today.
Sure. First of all, thank you, Amy, for inviting me and for letting me be here. There's a lot of amazing speakers, so humbled and honored to be amongst good company. For folks that are not aware of the work that we're doing at Planned Parenthood, I'm Ambreen Molitor. I'm the National Director of Product Innovation at Planned Parenthood, and I've been at the organization for about 7.5 years. And what we have been doing in the past 2 years in the innovation team, historically, we were building in-house products. In the past 2 years, we've actually been really honing in on our partnership arm and really bringing in startups in the pre-seed round to help them actually bring their vision to reality and also integrate it into our tech stack and ecosystem. The opportunity allows us to, co-develop in flexibility and customization. And, we'll talk more about what those companies are, what they do. And then the other arm that we have under innovation is a lot of research around generative AI and thinking about ethical tech and how we can be part of that conversation in a responsible and meaningful way.
Wonderful. We're pleased to have you and appreciate this conversation. So to kind of dive into it, talking about digital health and some of the partnerships and collaborations you mentioned, what are some of the most promising digital health partnerships that you've developed in the maternal and reproductive health space? And what, from your perspective, is making these collaborations effective?
Yeah, great question. So for context, we've worked with around 4 and soon to be 5 partners and startups in the organization. All of them have predominantly focused on the strongest sexual and reproductive health inequities in the United States. So that being unintended pregnancies, maternal health. And another thing we're looking into is the increasing STI rates. For me, particularly, these partnerships are meaningful in that together we are able to solve for or respond to those health inequities by creating solutions, showing numbers and impact, and having promise indicators that we're making some movement. I think the other thing that makes these startups really meaningful, and I can name 2 just to give like more color to the story, is that they also think about social determinants of health, right? So there's opportunities where we think about socioeconomic status, we think about one's lived experience, and those things really come to fruition in these solutions. So in terms of, socioeconomic status, one startup that we're working with called Autonomy allows patients to match to funds that are readily available on the federal, state, and local level. So if someone wanted to, for instance, obtain an abortion, they are able to connect to services that provide them the funding should they not have it and they want it. And what that really does is provide and decrease that access and barrier to entry for healthcare in general, which is cost. We talk about this a lot, where cost is a big barrier for entry in terms of getting the right healthcare one needs. Another startup that we're working with is called Poppy Seed Health, and they work in the context of providing virtual and in-doula support. And we're actually in a pilot phase with them, which I'm really excited about, really focused on maternal health and focused with the Black community in general, and figuring out ways that we connect with these patients and women and work with them from pregnancy to postpartum and monitor the progress and keep them empowered, educated, proactive, and really understanding their health and bodily autonomy. So those are just some examples of ways that we feel like have been promising, is that we're making meaningful choices where we're looking at the impact that we could potentially bring and looking at the overarching problem and what we want to solve for.
That's great. Those are great examples too of how how you're able to leverage digital to bridge some of these gaps that we have with accessibility and support. So great examples. And so again, and with the partnerships that you're working with, when you're working with the earlier stage startups,
Mhm.
that are, again, they're earlier in their development and some of their capacity. What has been your experience in working with some of those startups in the reproductive health space? And as you're working with them and seeing the promise and the potential, how are you tailoring the support that you provide to support their needs and vice versa?
Yeah. It's a great question. I will start with providing, what they are doing, what these startups are doing on a pre-seed round. What's really compelling about someone starting at the pre-seed round is that they have a blank slate. They don't have systems that are built in place where, if we were to work with an enterprise, say software, we're actually abiding or, agreeing to like the workflow or a template that they're serving us versus when we work with startups, both of us have a blank slate and we can draw from that and create a customized approach and something that's more appropriately tailored for us. We're unique in many ways, as one can imagine, in that we're very focused on a particular like lane of healthcare, but also we are in a space where there's a lot of opportunities where you have to be aware of policy regulations or things that are someone just needs to be a little bit more mindful of in terms of data and security and things like that. So I think for us, the pro is definitely and certainly the ability to innovate faster, quicker together, right?
Yeah.
And I think that comes from also thinking about not only the promising idea, but a really authentic leader. And it really, and I sound like a venture capitalist, but like and everyone says this, like the secret to a really good organization is someone that is passionate and driven and focused. And I would say the same for like really strong partnerships that we've seen. Some of the strongest partnerships that we have are when we see dedicated, focused, authentic leaders that really understand the problem, either have lived experience through it, and really understand it in a way that we will never. A lot of it is through firsthand experiences themselves, and someone that really understands that and are focused enough to say, like, I understand this problem so much, and I see the vision behind it and solution behind it, that I'm very much willing to like go down that route regardless of the obstacles that come through. So I think for us, that's sort of like amazing and sort of like providing us the customization, the innovator, and that sort of perspective we just won't have. What we provide, and the question you asked is vice versa. What we can provide these startups is the ability to make that idea a reality. So as I mentioned, a lot of these folks are, in their pre-seed rounds. And I think what's different than going to an investor is first, when you go to an investor, you seek the funding and then you seek a client. What our partnership brings is the opportunity for, to act as like a client vendor, and you get the funding, plus you already get a case study, and you get the exposure and access to our 600 clinics almost immediately, right? And really understand the diversity of location to patient to, the workflow that people set up in each one of these clinics. So I think for what we could provide is just the access that we have in terms of, the patient and clinics that we have under our organization. I think another thing we're really good at that has been beneficial to a lot of these startups is we're in multiple stages talking about it together. And so that access with partnerships with Planned Parenthood gives them the ability to be on more stages, connect with more people, network. And I think that's been something a lot of startups have said that have been incredibly beneficial, which is like you get the funding and the case study, but you also get to talk about the story together in really meaningful stages and tables that they wouldn't have access to otherwise.
Yeah, I think you hit on a number of key components of need and opportunity for the early stage, where it's really supporting that dynamic leader that has that passion and belief in understanding the problems to solve and is willing to really roll up their sleeves and do it. But then you're providing them with the ability to really generate the evidence that they need through your access to
Absolutely.
support the fact that they have a viable solution that can be scaled, which so it's a great marriage there of opportunity to
Mhm.
support each other's missions. So just thinking, in the Planned Parenthood space, taking slightly different direction in the conversation, was we think about digital health in the Planned Parenthood space, in the digital contraception space.
Mm.
Um, what are you seeing what are you seeing as opportunity? Because this is a sort of a new area of opportunity in contraception. What kind of solutions or collaborations in that area are you seeing? Are you excited to see? And are you doing anything now in this space?
Yeah, I will say I'm very excited about this space because there is truly the sort of pure definition of innovation happening there in terms of, we look at it from a perspective of we're seeing the disparity and then what are the solutions out there. And what we are discovering, particularly in the contraceptive space, is there's a lot of innovation around male contraception, which personally that excites me in the organization because what it allows that conversation to become is not one-sided. It's very democratic. So the choices you all make in terms of, the decisions you're making around your sexual and reproductive health are not one-sided. Now with male contraception, those are choices partnerships can make together, a person can make on their own. And there's levity and opportunity there. I think there's also this aspect openly, with the work that we do with Planned Parenthood, the ability to depoliticize the conversation a little bit too. And I think that is really compelling for us. And finally, not to say it last, but it's certainly not least. I think the innovations that are happening in the male contraceptive space are uniquely innovative, and it goes from anything from things that we are known and we provide those services for, but new medications, new innovations that are happening in those spaces are really cool to see, and we're very excited to work alongside researchers around the Male Contraceptive Institute to learn more. So that's something we're in discovery mode for. We're very close to trying to figure out opportunities there, but we're very bullish on it and think it's a very cool a way to innovate, but also think about new opportunities that are very appropriate for Planned Parenthood to be in this particular moment as well.
Well, I think it's another great example of a collaboration to bring forward these truly innovative approaches to a space that has always been sort of one-sided in many ways on the female side. So that's exciting to hear. And thanks for all the work that you're doing in that space to advance it. As we close out, I wanted to just get your perspective. The work that you're doing is very important, and we have a room full of very smart people that have a passion for the digital health space across many different therapeutic areas and sort of aspects, whether they're from the investor side or the startup founders themselves, or even advocates or other stakeholders in the healthcare ecosystem. From your perspective, what type of support can you recommend that they provide in this space as you're working through your opportunities and the individuals that you're working with? Anything they can do to help out as well?
This is such a great question, and thank you for asking, Amy. I feel like for our organization, what we bring to the table, as you and I just spoke, is the opportunity to show that their vision is a reality. Because we're a nonprofit, what we can show is a really strong impact story. But I think when it comes to revenue models or sort of a for-profit story, that's where, we are very much falling short. So if folks in the audience are from venture capitalists or in the space where you are open to speaking or mentoring with these startups, I'm certain they would be grateful, but we would be grateful as well because we want these startups to survive and thrive. And we are, as we are working with them, and the opportunities and intent is to work with them long term. But I think, as anyone would understand, if you're working with clients and vendors, you want to expose yourself to more than one client, and how does one do that? And all of those things are not something that we are well equipped to respond to, but would love partnership and opportunity to figure out how all of us together can make that happen for these fantastic innovations that we are supporting and are certain will be greater than the needs of our 600 clinics and our mission at Planned Parenthood as well.
Well, the good news is we have the chat functionality, and we have a lot of opportunities to connect here. So I would encourage everybody listening to reach out to Ambreen and just make the connection. You never know what can come out of that. But thank you so much. We could go on for much longer in this conversation, but it's really fascinating the work that you're doing and how technology is changing the Planned Parenthood space. So thanks so much, Ambreen. I look forward to talking with you again, and enjoy the rest of your day. Take care.
Thanks, everyone. Thanks, Amy. Really appreciate it.
You got it.
Bye.